personal for a senior gentleman whom I met in Michigan, who told me about his wife, who had been bedridden for 16 years. He told me he didn't know how he was going to be able to. As I said to you before, I saw a grown man cry. He was worried that he might lose his home, that they might lose their home because of his medical bills, and he didn't know how he was going to pay them. And most of all, he was too embarrassed to tell his children and ask them for help. How many times have you heard a story like that? And it's personal for millions of families who have gone into bankruptcy under the weight of rising health care costs. In fact, a high percentage of the bankruptcies in our country are caused by medical bills that people cannot pay. And it's personal for 45,000 Americans and their families who have lost a loved one each year because they didn't and couldn't get health insurance. That is why we are proud and also humbled today to act with the support of millions of Americans who recognize the urgency of passing health care reform, and more than 350 organizations representing Americans of every age, every background, every part of the country who have endorsed this legislation. Our coalition ranges from AARP, who, quote, said that our legislation, quote, improves efforts to crack down on fraud and waste in Medicare, strengthening Medicare for today's seniors and future generations. I repeat, improves efforts to crack down on fraud and waste in Medicare, strengthening the program for today's and future generations of seniors. To the American Medical Association, the Catholic Health Association, the United Methodist Church, and Voices of America's Children. From A to Z, they are sending a clear message to members of Congress: say yes to health care reform. We have also reached this historic moment because of the extraordinary leadership and hard work and dedication of all of the members of Congress. But I want to especially recognize our esteemed chairs, Mr. Waxman, Mr. Rangel, Mr. Levin, Mr. Miller, Mr. Spratt, Ms. Slaughter, for bringing this bill to the floor today. Let us acknowledge them. And I want to acknowledge the staff of the committees and of the leadership. They have done a remarkable, dazzling us with their knowledge and their know-how. I would like to thank on my own staff, Amy Rosenbaum, Wendell Primus, and Archie Siddiqui. And now I want to just close by saying this. It wouldn't be possible to talk about health care without acknowledging the great leadership of Senator Edward Kennedy, who made health care his life's work. In a letter to President Obama before he passed away, he left the letter to be read after he died. Senator Kennedy wrote that access to health care was the great unfinished business of our society. That is, until today. After more of a year of debate, and by the way, the legislation that will go forth from here has over 200 Republican amendments, and while it may not get Republican votes and be bipartisan in that respect, it is bipartisan in having over 200 Republican amendments. Then, after a year of debate and hearing the calls of millions of Americans, we have come to this historic moment. Today, we have the opportunity to complete the great unfinished business of our society and pass health insurance reform for all Americans that is a right and not a privilege. In that same letter to the President, Senator Kennedy wrote, "What is at stake?" He said, "At stake are not just the details of policy, but the character of our country." Americans will look back on this day on one in which we honored the character of our country and honored our commitment to our nation's founders for a commitment to life, liberty, and the pursuit of happiness. As our colleague John Lewis has said, we may not have